Hey guys! Today we're going to talk about the impact of Brexit on the NHS. This is the background. So, in June 2016, Britain voted to leave the EU as part of a referendum by David Cameron. And negotiations on the UK's exit from the EU started in June 2017, and talks are scheduled to finish by March 2019. The government currently has to incorporate EU law that cover health policy, including university fees for European medical students. But this could change so that the UK no longer has to follow these laws that benefit their citizens. So this is about the impact on healthcare professionals. The UK health and social care services are facing a significant shortage of staff, and Brexit will probably make it harder for EU staff to apply to the UK if their qualifications are recognised differently and immigration rules become stricter. And this could lead to worse staff shortages than they already are, as it would be harder to recruit as many EU healthcare staff. There are already severe shortages in medical specialities such as GP practices and psychiatry, and these could become worse. So staff shortages. In 2016, 150,000 EU citizens were working in the England's NHS and social care. For nursing, a combination of Brexit vote, stricter rules for English language ability, and changing to the funding of NHS training caused a number of EU nurses that applied to work from 1,304 in July 2016 to only 46 in April 2017. The European Directive on Mutual Recognition of Professional Qualifications standardises nurse training and medical training, which allows healthcare professionals to move easily between countries. However, Brexit could mean that this legislation might not be respected, and if not, EU nationals will find it a lot harder to work in the UK. So the impact on UK medical students is that in October 2016, the government planned for an extra 1,500 medical school places in England from 2018. And this was so that more British doctors would be trained in response to concerns about Brexit and to improve the number of doctors here in the UK. Brexit could benefit the UK and non-EU students by reducing competition for university places, because it could become harder for EU students to apply. But the impact on EU medical students is that currently they're charged the same rates as UK students for tuition fees, whereas international students pay around £17,300 for the first 2 years, and then £35,000 for the last 3 years, which is quite expensive. And Brexit could mean that EU students pay a lot more in the future. So, impact on research. The UK and EU countries have a strong scientific cooperation. Brexit could mean that joint research programmes could stop or become less frequent. Brexit could prevent the UK from accessing the EU side effect detection system provided by the European Medicines Agency. This could affect patient safety. So this is about the impact on patients. The e-HIC card allows UK citizens to be treated while travelling in the EU. So it could be harder or more expensive to receive healthcare on trips to EU countries after Brexit. But fortunately, in August 2017, it was decided that British pensioners who've retired to other EU countries, such as Spain, will continue to have their healthcare paid for by the NHS after Brexit. Patient care could become generally more difficult due to a lack of staff, for example, longer waiting times. Brexit in the news. So 1 in 5 EU doctors have already made plans to leave, and the new NHS budget was released on the 22nd of November this year, and Philip Hammond pledged an additional 2.8 billion of funding overall for the NHS by 2020, including 350 million given to the NHS this winter. Thanks for watching!